So Shailly, talk to us, because we had a big announcement the other day about the effect COVID has had on poor and low-wage people. Talk to us a little bit about that, if you would.
Well, so what we found, and we haven't been able to.
I'm sorry.
We haven't been able to talk about this yet.
Roads to prosperity.
So over these past 2 years of the pandemic, even though we know that poor and low-income people are on the front lines of COVID-19 as essential workers, as patients, as people living in crowded conditions without access to health care, there has yet to have been any comprehensive national level study on or analysis of how poverty and COVID have intersected. And so when we worked with the UN Sustainable Development Solutions Network, and we looked at county level data on poverty, on income, on race, on COVID, and we found that overall, poorer counties have suffered twice the deaths of richer counties. But at different phases of the pandemic, that twice went up to 3, 4, even 5 times the deaths of richer counties. So this is a tragedy that we are only beginning to wrap our minds around, and it's an indictment of a system that refuses to look at the poor and look at poverty.
We have numbers on West Virginia itself.
So we looked at county level information. We didn't kind of put that together up to the state, but we did look at Mingo County, which is, over 95% white. It's the center, this is where the historic Battle of Blair Mountain took place, historic labor struggle of coal miners. And in Mingo County, Mingo County is one of the poorest counties in the nation, and its death rate is among the highest, 25% of counties in the country.
Wow. And what you've been able to expose, the mainstream media hasn't talked about, the government hasn't even acknowledged it, has it?
Well, they just haven't been collecting data or putting it out on poverty. So no, it's been a blind spot, and it's again kind of a tragic blind spot. Meaning, a tragedy is something that didn't need to happen that way. Right? This did not need to happen. If only we paid attention to the poor. We paid attention to the 140 million people who were poor before this crisis. The 87 million people who didn't have health care or were uninsured. If we paid attention to this, then maybe this didn't have to be as bad as it was.
I got a reflective.
Thank you, Shailly.